connected network would look like. And what we came up with was a 35-mile trail network, all within Baltimore City, that leveraged the existing Greenway trails, the Herring Run Trail on the east side, the Jones Falls Trail in the center of the city, and the Glen Falls Trail on the west side. And it turned them into a 35-mile urban trail network. And what this trail network would do was connect all of the major anchor institutions in Baltimore City, so the universities and many of the hospitals. But it would also weave together a disparate variety of neighborhoods in East, West, and North and South Baltimore that have traditionally been separated by cultural barriers or built barriers in the built environment. And those barriers could be highway infrastructure, stream bed infrastructure, roadway networks, even the railroad network. So we began with local partners to take a step back and look at how we could turn those barriers into opportunities for connection. And that's the image that you're looking at now. And it leverages the existing trails, which are dark green, roadway networks that were designed by the Olmsted landscape firm, which is in the light green, and then an unused railroad line, which is in the bright yellow in the southeast section of the map. And we pair that with a overhead utility corridor, which is shown in red on the east side of the map. And leveraging that together, we get this 35-mile network that weaves between neighborhoods, connects open spaces, and we thought could serve more than just a trail network, but act as a community development tool and a public health tool and a economic development tool throughout the city. So looking at this idea, we didn't want to reinvent the wheel. We wanted to talk about what partners in the city were already doing. And we realized that there were different plans addressing the intersection of planning for open space, public health equity, and economic development. But there was no real unifying factor. So around this time, we discovered the Plan4Health grant opportunity, particularly the capacity building opportunity, and we realized that this could be the impetus to get us going in terms of forming a citywide initiative to talk about trails as the catalyst for this quality of life and public space enhancement tool. And so we wanted to take some of the best parts of the tools that you see here and the plans that you see here and use trails to really push them forward to talk about creating new changes in the public. In order to do that, in order to convene these broad-based stakeholders from across the city, we were able to use the Plan4Health funding to create different ways of talking about the trail network and to get different diverse partners to the table. And one of the ways that we did this was we talked about the economic development impact of trails and showing that these potential trail corridors existed along old pieces of infrastructure that could be turned around and developed in a mixed-use fashion to create new economies in the city. And what you're looking at here is an example along the Jones Falls Trail of retrofitted economic development happening. And to do that and to attract more of an audience, we talked about what was happening on the left-hand side of your screen. You see a situation in Baltimore, and on the right-hand side, you see the Atlanta Beltline in Atlanta, where a railroad corridor has been turned into an active transportation corridor that has spurred economic development. And these types of images get attention in Baltimore because there's a lot of similarities in the building stock and the infrastructure stock. And then we talked about it in transportation connections. The proposed 35-mile trail network would really serve as last-mile connections to the various existing and proposed public transportation systems in the city. So we were able to get to transportation advocates and bring them to the table by talking about how this trail network could serve in getting people from between their houses and public transportation options, getting them to major employment centers. And then we talked about it in recreation and quality of life, where a lot of the park and trail infrastructure in the city is separated from the residents and neighborhoods nearby by barriers in the built environment. So that led to engaging with communities, not necessarily about trails, but about safe streets and accessing the amenities that that have value in their neighborhood. So we were able to open up a dialogue about trails with communities in West Baltimore, not necessarily by talking about trails, but by talking about safe streets and access to the park, which on this slide, the Druid Hill Park is the example. And our Plan4Health target community was in the greater Mondawmin area, just to the south and west of this park. And in the broader map of the trail network, this is in the north central part of the trail loop. And then, of course, talking about it in terms of public health equity, and that brought a lot of partners to the table too. When the city is heavily segregated along social, economic lines, race, and class, but you're seeing that the public health disparities also tend to follow those lines. So by promoting the network as a tool to develop places where people can safely be involved in physical activity, and thus reducing some of the health problems associated with sedentary lifestyles and inactivity, we were able to bring in the public health sphere to this increasingly diverse network of partners that we were calling the Baltimore Greenway Trails Coalition. And in so doing, we were able to really leverage the grass tops and the grassroots resources that were available throughout Baltimore and get people talking about a trail network that might not normally be at the table when talking about a trail network, but in framing it in ways that make sense to the population that you're talking to, you start to develop advocates and allies to push the agenda forward. As the coalition got going, this is sort of the relationships that we wanted to develop, and it really led to strengthening the coalition beyond the usual suspects of public space advocates and park advocates. But when you can bring in some of the major employers from the downtown core and the economic development professionals alongside the more traditional community development professionals and the trails advocates, then you start to leverage your limited resources, and other partners such as major universities and hospitals see who you've brought into the conversation about trails, which is a topic that these communities aren't necessarily talking about, and then all of a sudden they want to join the conversation too, and it leads to more community outreach in their geographical section of town, but it also leads to more political heft and political allies when you're working with elected officials and funding sources to get resources towards your trail building initiative, which again helps with community outreach and design and planning, which really gives the coalition its ammunition to keep moving forward and keep the momentum going in developing a trail network. Highlighted in the pink shade in northwest Baltimore was the target area for the Plan4Health grant, and we were really able to focus our community outreach efforts and our grassroots strategy and our event planning in that region of West Baltimore, which was we picked because of its health disparities, public health indicator disparities, and the fact that the neighborhood was physically separated from a wonderful park and a really strong urban trail on the Jones Falls Trail. And over the last year, we've been able to broaden the coalition and what we call reaching beyond the choir to really bring in partners from all other sections of the city. And so you have people from the downtown employment centers, the outer residential neighborhoods, but all of the anchor institutions and major hospitals, universities, and a lot of developers, and paired with the traditional parks advocates, and open space advocates, we've been able to create this new dialogue in the city about what a trail network can do for not just one neighborhood or one demographic in the city, but really the entire city as a whole. So it's been a really neat learning process, and our work is by no means done, but by using the tools available, we were able to reach beyond the usual suspects and create a meaningful dialogue that will go on for a long time about trails, public health, and neighborhood design in Baltimore. Thank you.